It is more common in child. The main reason of the type 1 diabetes is immune mediated or the idiopathic. In the type 1 diabetes, the beta cells totally not produced the insulin. Type 1 diabetes patient are totally depend on the insulin. Their beta cells not produce the insulin. So if we are talking about the type 2 diabetes, okay, in the person who has a type 2 diabetes, the insulin is produced, but the insulin is not produced in enough amount. Approximately nowadays, the 90% of the people has the type 2 diabetes. Because of their most factors are included in the type 2 diabetes, that are obesity, that are the most common factor in the type 2 diabetes, lack of the physical activity level, and the poor dietary habit, and the main factor involved is the stress. Dietary factor influence the risk of developing the type 2 diabetes, and the people who has taking the more sugars, sweetened drinks, and the who has taking the type trans fat in diet in high amount, and the saturated fat, and the people who has not included the polyunsaturated and monounsaturated fat in diet. If and the people who has the more chances of the diabetes, that has no physical activity level in the daily routine. Some people control the type 2 diabetes by following the many tips, just like losing weight. If the person has a type 2 diabetes and obese, it's important to lose the weight and following the healthy diet and doing the exercise and monitoring the blood glucose level. The people who has a obese and overweight has the more chances of the type 2 diabetes. He should require to maintain the ideal body weight. The man who has a low level of the testosterone has a high risk of the type 2 diabetes. If we next types of the diabetes is the gestational diabetes. Gestational diabetes mainly occur during pregnancy. During pregnancy, if we are talking about this, during pregnancy, many hormones are imbalanced. Due to this, the insulin hormone are also balanced due to the some female condition like poor lifestyle, like poor eating habits. If the pregnant lady do not maintain the diabetes glucose level during pregnancy, it is a risk for the baby health and mother. If we see the gestational diabetes, 5 to 10% of the women has the gestational diabetes. So gestational diabetes is fully treatable but require careful medical supervision throughout the pregnancy. Manage it through the dietary changes, blood glucose monitoring, and in some cases, insulin may be required. The woman who has a gestational diabetes should require to maintain the weight after delivery. If they not maintain the ideal body weight after delivery, they should regain the weight, and also has the more chances of the type 2 diabetes if they do not maintain lifestyle or dietary habit. If the mother does not maintain glucose level or during the pregnancy, has more bad effect to the baby. His her baby should be a macrosomia, maybe a high birth weight, or the central nervous system abnormalities, or the skeletal muscles malformation, or the it should be to the during the gestational diabetes, the woman should have the high blood bilirubin level in her blood, and it can destroy the red blood cells destruction. So it is very important to maintain the blood glucose level during the diabetes, during the pregnancy if you have the gestational diabetes. If we are talking about the symptoms of the diabetes, the most common symptoms of the diabetes is the polydipsia, polyphagia, and polyuria. Polyuria means increase the urination, and polydipsia mean increase the thirst. Polyphagia mean increase hunger. In type 1 diabetes, the symptoms should be type 1 diabetes that are genetically are inherited in mostly children. In this, symptoms should be appear quickly. But in type 2 diabetes should be appear in older age, mostly 50 to 40 age, but nowadays it is very common in the adult age also due to the bad eating habit, due to the low physical activity level, due to the high intake of fast food, processed food, packaging food. So in the type 2 diabetes, the symptoms should be appear slowly. Okay? It should if we are talking about the symptoms, the person who has a diabetes should be a blurry vision, headache, fatigue, some healing of the cuts, itching skin. Prolonged high blood glucose level can cause the glucose absorption in the lens of the eyes, which led to change in its shape and resulting the vision change. The people should have the diabetes if not maintain the people should have the diabetes if not maintain the normal blood glucose level. So it's may damage her eyes, ठीक है, and it called the diabetes retinopathy. The some person must have the issue of the number of skin rashes that can occur in diabetes are collectively known as the diabetic dermatomes. The if we cannot maintain the diabetes blood glucose level in normal routine, in the future it can cause the many complications with the diabetes like uh, diabetic neuropathy. ठीक है, in the diabetic neuropathy, that kidney tissue scars, urine protein loss, and eventually chronic kidney diseases. Sometimes the person may shift to the dialysis or the kidney transplant due to the bad habit. Damage to the nerve of the body is called diabetic neuropathy. And the other complications include the symptoms that numbness in the foot and hand, tingling, pain, and it also can damage the skin. Diabetic patient has mostly the food problem, such as diabetic foot ulcer that mostly common. In the diabetic patient has also the painful muscle wasting and weakness that is the diabetic amyotrophy. How we diagnose that the person should have the diabetes or not. First, we should can take the blood test. Blood tests are also used to diagnose the diabetes and pre-diabetes. Some lab analysis of the blood is needed to ensure the test results are accurate or not. Okay. And the diabetic person should must check the fasting blood sugar level. The normal person, the healthy and normal person can check the fasting blood sugar level. It must be a normal value is less than 100 milligram per deciliter. If the fasting blood sugar level is 100 to is above to 125, the person should consider the pre-diabetes. If the value in fasting blood sugar level, if the value is 126 milligram per deciliter, then the person has a diabetes. For diagnosing the diabetes, we should also perform some tests like oral glucose tolerance test. Okay. In the how we should perform the oral glucose test, the patient should be unrestricted carbohydrate diet for the 3 days. Patient should be ambulatory with the normal physical activity level. If the patient should use any medication, should be stopped for 3 days. Smoking tea or coffee not allowed during test period. Oral glucose tolerance test should be carried out in the morning after the patient has fasted overnight for 8 to 12 hours. In the or to perform the oral glucose test in lab, the patient should give ingest the 75 gram of the glucose in 250 to 300 ml of the water over the 5 minutes, and after 3 hours, then we should take the test. The another test we should perform, we should follow for checking if the person has a diabetes or the not. That is a postprandial blood sugar level. This test should be performed after taking the meal 2 hours. And its value should be below 140 milligram. If the value should be below 140 milligram per deciliter, the person should be normal. And if your levels are between the 140 and 190 milligram per deciliter, above it indicate the person should have the diabetes. And the next test should also perform for the person has the diabetes or the not. The test is hemoglycated. Hemoglobin glycated. In this test, the any carbohydrate residue that bound to the N-terminal protein valine, the N-terminal valine of the beta chain. Its value should be must 5.7 below the 5. If the value should be below the 5.7, the person should be normal, and if the value should be above 5.7 or 6 to 7, the person should have the diabetes. And these tests are telling about the last 3 months of the glucose level are diabetes. So it is very important how to maintain the diabetes. ठीक है, it should be improved through the proper diet, following ठीक है, through exercise. Diabetes can be controlled by the exercise. The exercise helps the diabetic patient in many ways. Exercise plays a very important role in the diabetic patient. It lowers the glucose level. Exercise should lower the weight, help weight loss, and maintain the healthy heart and healthy circulation, blood circulation in the body. Exercise helps relieve the stress and strengthen the muscles. Regular monitoring and medication if you have obese, and should at one point at one meal, large portion, not taking the large portion at one meal. Now I am telling you about the that if we are talking about the fenugreek seed, ठीक है, मेथी दाल, it is the best herb recommended for the teaspoon of the we can take the teaspoon of the fenugreek seed in water, soak the seeds overnight, and then we should fenugreek seed salad वगैरह. We can sprinkle the fenugreek powder in some salad. Next, we are talking about the blackberry. This fruit is very effective in preventing and controlling diabetes. Conversion of the starch into sugar. Next, garlic is very important. Play a very important role in maintaining the blood sugar level. In the zinc and sulfur, which are the component of the insulin that maintain the insulin. Take about 3 to 4 flakes of freshly crushed garlic. About the flaxseed. This is the richest source of the omega-3 fatty acid, and we know omega-3 fatty acid is hair, skin, nails, eyes. It helps control the diabetes because it maintains the sensitivity of the cell membrane, facilitate the insulin, and thereby the uptake of the glucose by the cell. We should also include in our diet the most soluble fiber that is found in apple. If we are talking about the apple peel has important role to remove the cholesterol from our body and maintain the glucose. Kidney beans we should also include in our diet. Soya beans a steady release of the glucose. We should include those food that has a slow and steady release of the glucose in the blood. To control the diabetes, to maintain the blood sugar level, and reduce the cholesterol. In the diabetic patient should also include the is to remove the reactive oxygen species that create the free radical in our body, and the free some kidney वगैरह. Diabetes. Next, the antioxidant rich foods are the amla, fresh season, The fruits that recommended for the diabetic patients are the grapefruit. Grapefruit are rich in vitamin C. The grapefruit which is a flavonoid that improve your body insulin sensitivity. If the diabetic patient can eat half grapefruit patient should not take the fruit juice because in the fruit juice we should include at a time one above 2 to 3. If we can, the diabetic patient can take the juices, it can spike the sugar level with peel. It is best to maintain the glucose level. So if we can combine and increase the glucose level in blood immediately. So the diabetic patient should prefer the fruits in raw form. Kiwi is those fruits and vegetables should have the glycemic index is 20 below 50. Diabetes cherries has 20 glycemic index level and sometimes less than that because can vary. Antioxidant, iron, and contain the beta carotene, potassium, folate, magnesium, and fiber. It is useful for the diabetes. To diabetes, cherries are filled with anthocyanin and person. You can eat the cherries if the diabetic patient. Guava contain the guava contain digestive system. Guava is high in vitamin C. Vitamin C rich source and fiber. Diabetic patient is has this food is also very low glycemic index. Patient should prefer only small portion, small portion, not a plum. Plum, if we are talking about the plum, are the low in calories. Plum is a rich source of the diabetes patient has also suffer from the constipation. So the plum play a avocado. Avocado. Avocado has a also best for the hypertension patient because the avocado lowers store in our body remove. Apple, pineapple, it is also beneficial for the diabetic patient. It has an antiviral and anti-inflammatory properties. Pear is good fruit for diabetic patient. Pomegranate is good for the diabetic patient, but should peaches is also best. The diabetic patient should also, if we are talking about the cereals, the diabetic patient should prefer the barley has a low glycemic index. Oats, it's also best for the diabetic. The millets, it is the best because it is easily digestible and it is rich in potassium, phosphorus, and iron. The diabetic patient should also take rich in almond milk or coconut milk are patient. The diabetic patient should take milk or add some mint or flax. The diabetic patient and the diabetic patient should add flaxseed powder in a small amount. Almond is best for the diabetic patient. Cashew egg is best for the diabetic patient. Okay.
Assalamu alaikum. Dr. Mohammad Zafar here. Today's topic is inflammation. When we talk about inflammation, we define as the reaction of the living tissues